Ask Anonymous, where patients will type in questions to us over our email, and then I answer them for you. Ella and I are at the Cartessa Inner Circle meeting here in Boca Raton, and we felt what a better place than to answer your questions while we're enjoying Florida.
The first question is, I have been contemplating getting a tummy tuck for quite some time. I don't have a ton of extra skin or fat. Both are minimal. I was wondering if this could somehow change the cost. Also, I've been dealing with some neurological issues that haven't been diagnosed. Would it be safe to have surgery?
Well, that's kind of a two-part problem. So to address your first question, if you don't have a lot of fatty tissue or maybe some extra skin, then maybe there's some other modalities that might be good for you to help tighten that tissue without having a tummy tuck. That being said, a tummy tuck will remove some excess skin and also tighten the abdominal wall muscles. So there's many women that don't have a lot of extra fat but do have skin and some muscle laxity due to childbearing. So a tummy tuck would still be a good option for those patients. Now, if you're being worked up for some neurological problems, then I would tell you, make sure you take care of that first, and then this would be secondary to that.
Can someone who is stuck 5 to 15 pounds away from weight loss goals get semaglutides irregularly to meet their goals?
5 to 10 pounds away from their regular, or their ideal body weight, then I don't think semaglutides at that point are really going to help you that much. I think at some point, maybe that's just where your body is capable of living right now comfortably. So when patients ask me about ideal body weight, I usually tell them, your ideal body weight changes depending upon your age and your lifestyle. As you move through life, there are different demands with jobs, family life. So what I usually recommend is, what's the body weight that you can maintain with sensible eating, moderate exercise or activity, and that you can maintain without really starving yourself or having to go to the gym 4 or 5 times a week and exercising constantly. So if you're in that time, in that body weight, then I think it's okay to talk about some type of procedure that you would like to have. But at that point, I don't think semaglutides are going to be a good choice for you.
How much is skin removal for the thighs?
It really depends, because there's different ways of doing a thigh lift, and so that's where the consultation is so important. To come in, let's talk about what your goals are, and then I can examine you, look at how much skin, where it's located. Is it in the upper inner thigh? Is it down the entire leg? Where is it isolated to? And then we can talk about what that would cost, because those are two different surgeries.
Recent squamous cell on upper lip and tissue above, can it be made less visible?
So I'm assuming that you've already had the squamous cell removed, because you want to have that removed and with clean margins. And so after that, we can look at the scar itself, and I usually let scars kind of mature for about 3 months before we want to start intervening. So we can certainly see you in that time frame and see what other modalities, sometimes microneedling, sometimes massage, different silicone treatments. So there's different things we can do to get that scar to be less noticeable once the squamous cell has been eradicated.
If you have scar tissue surrounding your implant and you are about to get your mammogram, will they be able to tell the difference between the scar tissue, normal breast tissue, and cancer? Will the scar tissue get in the way of reading the mammogram?
So if you have scar tissue in your breast from previous surgery, many times they can tell the difference between scar tissue and cancer. What we're looking for cancer is microcalcifications, and so many radiologists can tell the difference. But they also have ultrasound and MRIs that can help them in their diagnosis as well. So in a nutshell, yes, they can usually tell, and if they're having trouble, they'll do one of the other modalities as well to help them.
What type of liposuction do you use? Is tumescent the best one that will tighten the skin also? I would really like the skin tightening on my abdomen, but I also understand that I may need a mini tummy tuck to achieve the desired look. I guess I would have to determine if I want to go that far, and of course, based on your assessment of my skin.
Well, again, that's when the consultation is really important. You really have to be assessed because it depends on how much extra skin you have. Do you have abdominal wall laxity? Do you have stretch marks? What's the quality of the skin? How much adipose tissue do you have? So some patients need a tummy tuck and maybe some liposuction. Some patients can do liposuction without a tummy tuck. So it really needs to be assessed. Now, as far as liposuction, I always use tumescent. I think that's the standard of care in the United States is to use a tumescent solution, which is saline, lidocaine, and epinephrine, and that helps numb the area, plus also causing vasoconstriction so that there's minimal blood loss. So that's the start, but that's not the style of liposuction. I combine phaser, which is ultrasonic, with a power-assisted liposuction cannula. And then on skin tightening, I use a device called Renuvion, which is a third cannula that can help coagulate the tissue and tighten that skin envelope as well. So if you don't have a lot of excess skin and liposuction is a good treatment for you, then I would talk to you about adding Renuvion to help tighten that tissue up as well.
Is breast reduction possible for overweight patients?
Yes, and so many times women have a hard time losing extra weight because their breasts are so large that it causes them pain. It's very difficult to do physical activity, so to a point. So when you come in, again, that's one of the things we'll look at when we assess you for a breast reduction is the weight that you have, how much weight would you need to lose. But a lot of times we can go ahead with the breast reduction even if you're still overweight in a safe amount and get you through that, because a lot of women find that if the breasts are reduced, they have less pain, they're able to exercise better. And so a lot of women after a breast reduction, it's easier for them to lose weight.
Which is better, deep plane or SMAS surgery?
So there's a lot of controversy. There's different ways of doing facelifts. And so there is right now a deep plane facelift is sort of a talk. But over the years, a SMAS, which is the layer of tissue under the skin and on top of the muscle, whether you're doing a SMAS dissection, so you get under that layer of that fiber fatty tissue, the deep plane just takes it a little bit further. So I like to do a SMAS dissection with resetting the SMAS. The deep plane goes a little bit further. You have more swelling post-op. Both are excellent, and I don't think there's one, in my opinion, I don't think there's one that's better than the other. I guess it's just really what your surgeon feels the most comfortable doing. And realistically, when you're 6 to 9 months or a year after surgery, it's hard to tell the difference.
How often should injections be done to get rid of wrinkles around the jowl area?
Again, that is an assessment question. And so depending upon the jowling, a lot of times we don't use injectables, dermal fillers in the jowls. Sometimes we can put them back in the back of the jaw to help give it a little bit of a lift. But a lot of times if you have jowling, we don't inject into the jowls because it makes them fuller. So there's different things that we can do to treat jowling even before surgery. So again, it would just depend on how much jowling and what your expectations are.
Can I or can't I have submental liposuction without a lift? I am older, I know this, I have extra skin. I would also like to do it in 2 different sessions or surgeries.
So there are some minimally invasive and non-invasive ways of treating that area. So for submental liposuction, one of the main things that I use now is my Lipo AI device, and you've heard me talk about it before. It's laser lipo. We do that in our procedure room in one of our offices. The nice thing about that, it will treat the excess skin in this area all the way back to the jawline, all the way down to the thyroid cartilage. But because of the heat, it's actual laser lipo, because the heat that the laser gives off, it can help tighten that skin. So I've been using that. So you don't always have to have a neck lift or a facelift. Sometimes patients are amenable to the Lipo AI, which is an amazing device. And then we also have a Virtue device, which is microneedling and radio frequency, and that can also help just using topical numbing ointment for about 40 minutes, and then we use that device. That will take multiple treatments, about 6 weeks apart. Sometimes that can take 3 and 4 treatments, but it does cause some tightening of the tissue. Again, it really depends on our assessment and what your expectations are.
I had my second child last year at age 42. Even though I'm active, muscular, and have a low amount of body fat, my midsection has a good bit of loose, sagging skin from 2 pregnancies that I can't get rid of. Is there any way of tightening, reducing the excess skin from my front and back midsection without requiring surgery? And if I do need a tummy tuck to resolve this issue, how soon would I be able to lift my children and resume normal activities?
Given the description of your body habitus, again, I'd have to see you and really assess it with you. It sounds more like a tummy tuck would be your best option. The downtime for a tummy tuck is about 3 weeks before you can get back to exercise and household chores. Also, depending upon your children, a lot of times I have patients, just be careful. You still have to be a mom after that surgery, so you just have to be careful, but that's something we always talk about in the consultation.
Last question, what are the downsides of plastic surgery?
I think the downsides are the downtime for it. So sometimes, patients will need 3 to 4 weeks getting back to work or getting back to exercise or getting back to your lifestyle. So a lot of times patients need to get back to work in a short period of time. So depending upon the surgery that you're looking for, that might be the biggest deterrent. But other than that, it's otherwise pretty well tolerated. Our pain levels after surgery are minimal, easily treated with just 2 to 3 days of some pain medication if you need it. So for that, it's easy to be tolerated, but sometimes what patients will say, it's the 2 to 3 to 4 weeks. There are some surgeries that you can get back to work in a few days to even a week, but depending again upon the surgery that you are looking at, the post-op downtime will vary. Well, thank you so much for your questions. I hope I answered them adequately. Please, if you have any other questions, feel free to write them in and we'll get back to you next time.